Hey, everybody. My name is Joseph Gaines, and thank you guys for having me this afternoon. The name of my case is a rare domestic case of human tracheopulmonary myiasis caused by Cuterebra species. Had a few different people helping me out with this one, but we had no financial relationships to disclose. And also, I'm a fourth-year medical student at the Medical College of Georgia in Augusta, just so y'all know. Next slide, please. Okay, so here's some of the things we're going to try to talk about. So we're going to discuss risk factors for developing myiasis. We're also going to try to identify some of the common presenting symptoms and also some of the things that you might see when you're trying to diagnose the disease. And then we're going to talk a little bit about treatments and some of the things that we can do once you've acquired myiasis. Next slide, please. All right, so a little bit of an intro here. So the first question is, what is myiasis? So the word itself, myiasis, a word derived from the Greek word mya, which means fly, refers to the infestation of human or vertebrate tissue with larvae, also known as maggots. So it's basically when maggots end up infesting human tissue. So kind of nasty, but that's what it is. So myiasis in humans is associated with poor hygiene and low socioeconomic status, and it tends to aggregate in tropical climates. So we're really thinking places along the equator and especially like third world countries and places that would have a lot of poverty and that type of thing. So in the US, myiasis is pretty rare. So only 4 other cases of pulmonary myiasis have been documented in the medical literature within the US. So the case that we have here, we describe a patient that presented to the ED after expectorating a live Cuterebra during a coughing fit. And just so y'all know, Cuterebra, that's the genus of this type of maggot. Next slide, please. Okay, so our case report. We have a 51-year-old white female presented to the ED after expectorating a live Cuterebra larva during a coughing fit. She reported recent travel to Florida and recalled an insect flying into her mouth while she was on an evening walk. And then a week later, she developed a non-productive cough. She was subsequently treated for bronchitis with antibiotics unsuccessfully. So they tried to treat her and it didn't work. On presentation, she was afebrile and appeared without distress. She had a marked leukocytosis, or a mild leukocytosis, but a marked eosinophilia. She brought a larva with her in a bag that she claimed to have coughed up. The live specimen was subsequently sent to pathology, where it was measured at 15 millimeters in length. Next slide, please. So here's our actual specimen. So the lady that came into the ED, she actually brought this maggot with her in a bag, saying that she had coughed it up. So next slide, please. So the specimen was subsequently recognized by the entomology department at the University of Georgia to be a larva from the genus Cuterebra. So one of the people on the paper was the entomologist who identified this organism. Then the patient underwent bronchoscopy, revealing a protuberant mass in the left posterolateral portion of the trachea, and forceps were used to remove a tissue sample from within the cavitation. A tracheal biopsy revealed chronic tracheitis with eosinophilia and retained larval fragments. After the specimen was removed, the air was debrided and irrigated with saline. And the patient had a complete resolution of the symptoms within 3 weeks. So yeah, one of the first things they did was physically had to take or mechanically remove the specimen before they could actually treat the disease, so to speak. Next slide, please. So here's our CT findings. On the left, we have an axial slice kind of at the level of the mid-trachea, and you can see this circular area where the organism had actually burrowed into this person's trachea.
Oh, slides.
And then on the right, we're going to see a coronal view. Again, you're going to see this kind of circular area where the maggot had actually crawled into this person's trachea and found a home.
Maggot in the trachea.
All right, and next slide, please.
Excuse me, sorry. If you could just mute yourself during the presentation, appreciate it. Sorry about that. Thank you. Please continue.
All right, and so here's our 3D recreation. So kind of right in the middle of the trachea, and it's on the left posterior lateral location. As you can see, we're coming down the trachea. You can see the carina in the left and right main bronchi. And it's just this big outpouching that we see here. All right, next slide, please. So our final diagnosis is tracheopulmonary myiasis. Next slide. So what do we do from here? So initially, we're going to mechanically remove the maggots, and then we're going to follow this up with antiparasitic drugs such as ivermectin, and also some anti-inflammatory drugs, so steroids, prednisone, that type of thing. Repeated bronchoscopy with saline wash helps remove any remaining larvae without damaging the bronchial epithelium. And so like in our case, there actually were some remaining pieces of the larva in her trachea that the pathologist saw. So you want to make sure that you get everything out. So the bottom line here for my presentation, tracheopulmonary myiasis it's really rare here in the United States. But if a patient comes in with unexplained respiratory distress and hypoxia with a recent travel history to tropical regions, then it's something that could be considered. So like in our patient, she had just been to Florida. More likely you would have something more like, Central America or that type of thing, but it does happen from time to time here in the States. All right, next slide. And here are my references. And thank you guys for listening.
Thank you very much. That was really interesting. Normally I try to hold back on questions personally as a moderator, but I'm just curious, how far north do you see this species of fly?
Ooh, I would probably need to call in an entomologist for that question. I do know, like, out of the 4 cases that had been found, like 2 of them were from Florida. And I don't know where the other 2 came from, but yeah, I don't really know exactly where this fly lives. I wish I could answer your question a little better.
No worries. And also, this opens the floor as well to anyone else who might have any questions. I didn't mean to monopolize the question period. If there are no questions, then thank you very much for a very interesting case.
Thank you.